want to welcome each and every one of us in our meeting today. And I can see that we are all in. I can see there are some people who have gotten. Dr. John Mwangi, you're welcome. We have already 6 participants. Vitedo for Africa. We have Missouri, Young African. We have Diana Dovan. We have Wabu, and others are still getting in. So we are starting our program today, and we are going to look at how we can be able to fight this menace that we have today, COVID-19, which is a menace that has really disturbed each and every one of the society. If you walk everywhere, if you listen to news everywhere, you can really tell that things are not right. And because we are having issues with this disease because it is very new to us. Everyone is asking, how do we get this disease? How do we contain ourselves? How do we maintain ourselves? And how do we protect ourselves? And therefore, we have come up with this program so that at least we can have professionals helping us to answer the questions that we have. With us, we have Dr. John Mwangi. He is a pulmonary disease internal medicine, critical care medicine at SLU. And also we are having Dr. Niho Tutram. He is an expert in chronic disease epidemiology and manager at St. Louis County Public Health and Human Services. I want to welcome Dr. Mwangi. Dr. Mwangi, can you hear me? Thank you so much. Dr. Mwangi, you're welcome to the program today.
Thank you.
Yes, and I would like you to introduce yourself to us.
Can you still hear me?
Yes, I can still hear you very well.
All right, thank you. So my name is John Mwangi. I am pulmonary and critical care. I work at through hospital. And I just left there now, whereby we keep changing our protocols every day due to what we anticipate. And we are looking forward for this day to educate our fellow African and immigrants on this condition. So our goal is to try and help explain the facts and make sure that our people are well informed.
Yes. So, Dr. Mwangi, without wasting time, I would like you to tell us about, I have some few questions before we get some questions from the public.
Sure.
And I would like you to just introduce to us to this, to COVID-19. Can you tell us why COVID-19? Why do we call the virus COVID-19 and why don't we have another name for the virus?
So the virus it's called coronavirus. So it's the word COVID was coined from coronavirus infectious disease, and because it was first noticed in 2019, that was when the first cases were noted in China. So that's why it was given 19.
Okay.
It has almost the same configuration genetically as SARS and MERS. Those are the viruses that we know. SARS has happened way back in 2002, while MERS happened sometimes in 2011, 2012. So it's about the same virus, but genetically is a little bit different. But it's keep changing, and you can see if you look through the website, CDC website, they are also calling it SARS-CoV-2 or COVID-2, meaning it causes the same kind of a problem, which is severe acute respiratory symptoms, which is the SARS, and then they add COVID to say it's coronavirus associated, and this is being called number 2 to differentiate from the SARS that happened early 2000 with the current coronavirus.
Okay. So can we say that, okay, so this, we can say that the CDC had already identified the disease before, and they had already identified some of the characteristics of the diseases and symptoms and such. So we have another question that I would like to ask you, Doctor, because this is a new disease to us, and the disease is spreading too fast. Can you tell us how is the disease? Which are the main ways of spreading the disease, or how does somebody get the disease?
I think to put it simply, I would say you have ever had a common cold.
Mm-hmm.
The kind of common cold that you had, you don't know what virus caused it. We currently have another coronavirus that usually is very rampant in the community, and we see those viruses a lot when in ICU.
Yeah.
However, for this particular one, the one thing that we know about it is that it is, as I said earlier, genetically different from the coronaviruses that we know.
Okay.
And as a result, we are not prepared, our body is not prepared to fight it. And you know that if you get a cold, likely chances are somebody in your house is gonna get it. If it's a co-worker, it's gonna get it because it's common cold. It's spread usually through the droplets in the air. So when you cough, the small mist that you discharge from your mouth is the one that travels from you to the other person.
Okay.
The other way it is transmitted is through contact. You know, a lot of people when they cough, some cough with their mouth, covering their mouth. You know, that's what we were taught.
Okay.
And then if I shake your hand, but what I was saying is that when you touch your mouth, when you cough on your, or when you cough on your arm, and then you greet somebody,
yes,
that those viruses are transmitted like that.
Okay.
So it's the same transmission mode as any other common cold. The only thing that that we don't have is immunity to it.
Okay.
So if you get a very few droplets of these viruses, then they keep multiplying because your body has no ability to fight it.
Okay.
And then you pass it over to somebody else, and that somebody passes it over to the other person.
Okay. What are the chances of young people getting the disease compared to the old people?
Everybody will get the disease, and I said will because I will get it, you will get it, but the only difference will be how we're gonna fight it.
Okay.
For us young people and even the kids, they have no other medical problems, and therefore their ability to fight this infection is good because their other organs are working well. The only area that is affected is only your respiratory system. Okay. What I mean by that is your nose, your mouth, your throat, and your lungs. But if you bring somebody else with heart disease, somebody else with kidney disease, or somebody else with other chronic problem, like those who need medication to suppress their immunity to fight certain kind of diseases, those are the patients who are getting the worst of it.
Okay.
That's why you keep hearing from the CDC and from White House briefing that it seems to be worse in only about 80%, and majority of those are the elderly.
Okay.
Because those are the people who have all these comorbidities.
Okay.
That's not to say that it cannot affect or it cannot really be worse or it cannot kill young people. We have seen it affecting people. We have heard about young child less than 10 years old in ICU on a ventilator. Recently, I heard, we had a young person, the age of less than 30, came in and died. So anybody can be affected, depending on how well you're going to be able to fight the infection.
That's good. Now, there is a fear that sometimes when somebody in the family get the disease, like maybe a parent can get the disease. Maybe the father has the disease. and he has been told to quarantine himself or to isolate himself, what are the how should this happen? Because maybe you have a family, you're living in maybe a small house or such. What are the processes of quarantining yourself if you happen to get the disease as a member of the family?
So that's a very good question, and the way to approach it is this way. And one thing is protect yourself from getting it.
Yeah.
How do you do that? You do that by now limiting the movements. We have been told to lock down. We are all supposed to be homebound.
Yeah.
There is a reason for that. That is the protection part of it. On the other end, we know that some people will get it. I work in the hospital. I take all the precautions, but when I get home, I have to make sure that I protect my loved one.
Yes.
And how we need to go about it is that make sure you wash your hands very frequently. If you are working in a health facility, you come into contact with a suspicious case, you need to take your clothes away from everybody else. You need to wash your hands, you need to shower, you need to clean up your car keys, you need to wipe your car. And then, because you don't know if you have the symptoms, you need to isolate one of the room that nobody else is going in, for you to stay there during this period that you are on quarantine. That way, you will ensure that by the time you show the symptoms, you are not transmitting it to other people.
Okay.
However, if you already have symptoms, everybody that you have interacted with before now, chances are they have got it. So, because it takes about median of about 5 days from the time of exposure to the time of symptoms expression. We don't have enough data as to what is happening in between. We are telling people to quarantine when you have symptoms, but what happens in between when you got exposed and when you got the symptom? You most likely have been shedding it. So if you know you get into contact with someone, you don't have symptoms, quarantine yourself.
Okay. And let me ask a good question. We have those people who are in isolation. We have any treatment which they are getting. In the real sense, do you have any treatment right now for those people who are already infected and those people who are in quarantine? Do you have to stay? Do you have to sit back and wait until the 14 days are over, or you have to just sit and wait for nothing? Or what should you wait for?
And I'm pretty sure a lot of the listeners are following up on this question, because we keep being told, oh, there is a medication, we keep being told there are no medication.
Yeah.
The real fact is that there is no approved medication so far. We have medication that have been shown in very few observations that they may be giving patients some relief, but we know that none of those medications have for sure been studied and found that it's killing the viruses.
Okay.
So what we have now, and I'm pretty sure you're going to ask me, is about chloroquine. Hydroxychloroquine is the formulation that we have here in the US.
Yes.
Elsewhere is chloroquine. So that medication has been there for a long period of time. We use it quite a lot for treatment of arthritis and other conditions.
Yeah.
And it has a way to modulate the immune system so that it helps you, even though you are having pains, it modulates the pain receptor so you don't have so much. And when it comes to this virus, it have been shown in the lab that it's also altering the way the virus interact with our body cells. And that's where everybody is trying to understand more. If we use it, there is not that the virus will not permeate into your body cells, and therefore you're gonna be able to eliminate it quickly. It's very promising, but we don't have enough data to suggest that everybody who has this virus should get on that medication. In fact, the current guideline is that if you have mild symptoms, quarantine yourself, take pain medication, rehydrate yourself. You don't have to take it. But for people who come to the hospital, we observe them, we see how they are progressing, we look at their labs, and if we see like they are profoundly sick than the way they look or the way they feel, we put them on those medications, but with very close observation. Because that medication can also be associated with significant side effect, and sometimes it can even cause some toxicity that may lead to death.
That's good. That's a very, very, very good answer that you have given us, because in fact, many people have a lot of fear. And if you go to the social media today, you listen to people chatting about this. In fact, I discovered about chloroquine a long time ago. It had been posted by someone in France. And they said it had been used in France and China, and it had been found to be more accurate. But to some extent, you know, there are some restrictions when it comes to the use of medicine in the United States. So some people, like the immigrants, maybe from Kenya, they were asking, they are already aware of this chloroquine because it has been used in the treatment of malaria back home. So they were asking, is it possible for me to carry myself, to carry some for myself, or to send someone coming to come with a package for me? How do you find that?
No, I understand, and I heard even from my medical group chat that now that medication has ran off in Nairobi, in Mombasa. We can't even find it in the pharmacies because people are stocking it for themselves. The only thing I would say about it is that as I said earlier, it is associated with a significant side effect. And I think earlier today we saw a case from Nigeria of someone who had toxicity from hydroxychloroquine. So it is not proven that it works. We know it's virus, and most of the time the virus, the body will take care of it. And all we do, even when we bring those people in the hospital, is mainly supportive care. We try to support their lungs, we support all the other organs, and let the body take care of the virus. And with the time, that can be achieved. However, as I said earlier, for those patients with so many other conditions, then they may be overwhelmed because they will have more than one system failing, and that's how they will end up succumbing.
Oh, that's true. Really, this is very serious.
It's a serious thing, and that's what I thought when I talked with Jeffrey. I was like, I know I talked with one Shosho. Shosho is still taking care of other people's kid. And I asked her about what she knows is going on. She is getting information from Kenya. She's not getting information from here. And I was like, if this is the case, I'm pretty sure a lot of our people are so behind. Kenya, there are only very few cases, and all of them are stable. When you come to US, it's going like a bonfire, and it's gonna get to the people, and they will most likely get it even before they get the right information. And you have heard, and use this slogan, it's not to be arrogant, but to say, you know, your loved one will be your worst enemy, especially if you have those conditions that I'm talking about. We can have them taking care of our kid, but we know that if they get some symptoms, as chances are they're gonna end up in the hospital. And one thing that we are worried about is we keep talking about the curve. We are talking about the curve because I don't want a loved one to come to the hospital and I don't have a ventilator machine to put them on. I don't want them to come when I have no resources. They can go ahead and quarantine themselves for now. We watch how it's gonna go. We treat the few people who are gonna get it. If you get it later on, you're gonna get it when we have enough resources.
Yes.
That will be better off, because like here in St. Louis, right now we are preparing. We have started seeing cases trickling in the hospital. We have seen the county department giving us many more numbers. Today in US, by only today, we have more than 2,000 new cases.
Wow.
They keep increasing, you know. And New York right now, the governor is saying that they don't have enough staff. They don't have enough ventilators. They're gonna start considering and deciding who should we put on the machine, who should we not put in the machine, and let the nature take its course. We don't want to make that decision. It's a decision that no physician would like to make, because we know everybody should be given a chance. But if we all get sick at the same time, I'll be looking at your age. I'll be looking at your other condition and deciding, oh, this is 45-year-old, doesn't have many medical issues. We can get him better and get him back to the society. But I have a 70-year-old with the diabetes. Oh, what am I gonna do? So I'm gonna be throwing the coin to decide who should die and who should not. That's the situation that we don't want.
Yes. So that's very serious. And in fact, you have answered a question that has been disturbing us so many times. Because, by the way, most of us are getting the information from the social media. And in fact, getting the information from the right person like you, you're a professional. You're handling such cases and you have seen it in the real sense. I believe you're the right person to tell us and to keep updating us. And I would like to thank Vitedo for Africa for organizing this kind of webinar, because, and also thank you for feeling yourself, because this is very serious and it is coming to a point that now each and everybody need to fear, wherever we are. Yesterday was the first time that we hosted a streamed church service. And I saw that really, if our people take caution, we can help in eliminating this disease. But there is one problem that I discover amongst our community, and this pertains to the culture. We have this culture of greeting, the greeting. I don't know.
Tell me about it.
Yeah, Doctor, I don't know how you can really help us to sensitize ourselves on how we can really stop these greetings by the use of hand.
If I shake your hand, so what I would say is that it's our culture to shake hands, it's our culture to hug. But my major concern is that that is what's gonna bring us the virus. And we have been told to socially isolate. So what I would say is that it's a matter of deciding, what do I want to do? And you are informed that this is not the best way now. Instead of shaking hand, do the fist bump, do the elbow bump. Some other people are going even further and doing the feet the feet dance bump or something like that. And trying to socially distance yourself, and especially if you're interacting with people who are not member of your nuclear family. Because if you are a nuclear family, you have been staying together and you have not had any issues about it, then you'll be fine. You'll be fine. And if you have it, you confine it to yourself. You don't spread it out. Because this now, as everybody is saying, is like a war, and everybody has been called to play a part and prevent spreading the germs. So you, as a pastor, together with other people who are listening, I would ask them to emphasize that we need to change our culture of greeting and heed to the call for distance. They're talking about 2 meters or 6 feet apart. this all gonna help us. It's a wave that's passing. Come 2-3 months, then all this will be lifted and we'll go back to where we were. But we want to go back to where we were with all our loved ones. We don't want to be the only one. You know what I mean?
Yes.
And especially for young people, they need to have their socials around and their cards around instead of us being there where we have lost so many.
That's true. Now, can you tell us about how the virus is, or how long does the virus take when maybe the virus come into contact with the different services or different things like metal, doors, or services? Can you tell us how long does it stay on the service?
Good question.
Maybe if somebody has come into contact, how much time does it stay in the herds?
Yeah.
In the service, like doors, tables, and such.
So there is a study that came out mid last week. That study talked about the lifespan of the virus, and they looked at the air, and they I don't know how they did it, but they found that once you release those droplets in the air, it may take up to 3 hours, 6 hours before they clear completely.
That is in the air.
That is in the air.
Okay.
That one, we don't have so much how they did it and how they came up to really define it. So I've not emphasized on it so much. Okay. The one that we are aware of is the contact to either cardboard or silverware or the door handle.
Okay.
For those one, for the door handle and the silver presses, they are talking about 48 hours to 72 hours. So you're talking about 2 days to 3 days of the virus sitting on that doorknob, waiting for somebody else to come. And you know what? It doesn't just sit there, it continues to multiply. So that's why we are saying if you are going somewhere, try and avoid touching the doorknobs. Instead, if you have to open a door, get a tissue paper or something else and open, or if you open your hands, immediately you use hand sanitizer to clean your hands. And there is also the question about the cardboard, because now we are going to the store to get the food, and we are also shopping online. And there is concern that the boxes this food is coming with may also be contaminated. So there are some few recommendations that once you get these things that are coming from online, open and get whatever you need, sensitize it, and then go ahead and throw away the cardboard. Okay. The other way other people are talking about is spraying the cardboard or the cartons with the hand sanitizer. Okay. You spray it around, and then you know that before you handle it, and you know that most likely you have killed all the other viruses. And then always wash your hands. Okay. Nowadays, I think I have heard from the FedEx and UPS. Okay. They are just dropping they are dropping whatever they bring you. They have given those recommendations. They are not requiring signatures. Okay. Because they don't want to contaminate you, or they don't want to get contaminated.
Yeah. Oh, that's great. That's great. That's a very good initiative. And I would like us to I would like you also to tell us about maybe when you shake hands with someone, how long does it stay in your hands? Or handshake?
I would consider it to be just like any other service. So if you cough on your hand and you have the virus, or you shake hands with somebody else with the virus, it's gonna remain in your hand for almost 48 hours. And unless you wash your hands, I'm pretty sure most of the people within few hours they have gone to the bathroom and washed their hand.
Yes.
But all the same, I would say if you have in your car, carry a hand sanitizer. When you are getting out, sanitize your hand. When you get in from the store, use hand sanitizer and clean your hand. Always keep this going all the time.
Yes.
This is one of the period that we recommend that do hand washing, use as much water and soap as you can.
Yes.
Yeah.
And there is a question I'm finding. Can you please share how long the virus lasts on clothes and plastic bags from the store? That's a question that is being asked by somebody who is known as Brenda.
That's a good question because we are all concerned about it. We, especially as healthcare givers, we know we go to see these people, we come out and we are wearing those scrubs for the whole day. Quoting that particular study, that's the only one that we know that we can talk about now. Talking about, the silver hard surveys, the table counter, they're quoting about 48 hours.
Okay.
So I would extrapolate from there and say that if you have your clothes, chances are it's gonna last there for some time. Okay. It's gonna even become worse if the clothes are damp or something like that.
Okay.
So the recommendation, and this is how we plan to practice when we get a very huge load. We do have scrubs that we wear, and those people who have those who work in those facilities should also take precaution, is to wear scrubs at work and take them and leave them at work. Dress up on your home clothes and drive back home. Because you don't want to contaminate your car. If you contaminate your car, then those viruses are gonna linger there for a while. Okay. That's one alternative. You can take them, put them in a paper bag, then immediately when you come home, put them in a washer. And in this instance, we are recommending that you use hot water to wash them. And if possible, wash them separately. When it comes to the plastic bag and things that we get, when you go to the shopping, it's gonna be about the same principle. That's what we're gonna employ. That about 48 hours, it can be on that surface.
Okay.
Yeah, because I'm saying that study because that's the only study that is out there showing how long it can last.
Yeah. So sometimes you usually have some stores where you usually go to buy used clothes like Goodwill and such. Do you recommend that we have to stop completely at this particular time?
That's a good one and a hard question.
Yes.
Yeah, I know sometimes when someone is going to get something is because they need it.
Yeah.
And there are several ways that you can go about it. This is a virus or whatever those clothes can be carrying. It could be a bacteria or virus. It can be killed by washing with hot water. Okay. If you have to go to buy something in that place and you are very concerned about it, go ahead and wash it. Go ahead and wash it. Go ahead and dry it. And chances are, by the time it goes through several cycles of hot water, those bacteria will have, with detergents, those viruses will be dead.
That's great. And I would like to welcome all the participants and encourage them to ask questions. You can post your question on the chat. If you have a question, Dr. Mwangi is ready to answer the question. Apart from the treatment that we have today, we have some home remedies. We have some home remedies that people usually use, like we have people usually use garlic and lemon and such kind of things, which have been proved to really have good impact on the improving the health. Can you tell us whether we have some home remedies that we can use to fight this virus? or maybe something that you can take to help to protect yourself from the virus. You know, protection is better than cure.
That's true.
Yeah, even hear some people talking about hot lemon. You can take hot.
Yeah.
I had some others saying that you can steam yourself. You can steam yourself. That kind of theologies that people have come up with right now. I even had someone from Tanzania saying that you can use soil. I don't know. Now, because you're from the medical field and we are lay people, we need to really advise us whether these are true, and if there are something that we can, there are some things that we can use. Let us know.
That's very good questions. Because I have used those before. You know, hello.
Yes.
Okay. Yeah. So those are things that are practiced everywhere. And the only thing that we don't know how effective they are.
Mm-hmm.
So we in the medical field, we usually try to use well-proven therapy that has been tested and proven to be effective.
Yeah.
And at the same time, you will hear us talking about dosages, right?
Yes.
Yeah. So meaning that it has been tested and proved that with this dosage, it's going to be effective and it's not going to cause any harm.
Yes.
On the other hand,
Mm-hmm.
if you use things over the counter, we nobody regulates them, and we don't know how much medication they have, and we don't know what's their immediate effect and their long-term effect.
Okay.
And therefore, that's why us from the medical field, we don't recommend such things. However, that said, everybody, there is something they do to make themselves feel better.
Okay.
And from my end, I would say, if hot lemons makes you fight the fever and it does it well for you, go ahead and use it.
Good.
If the other people talking about ginger, you know, go ahead and use it. However, we know that they are also associated with some side effect. It's well proven that too much of ginger can be associated with corrosion of the stomach, and people may start coughing blood or having blood, passing blood in their stool.
Mm-hmm.
So do those things and do them in moderation. If they have worked for you, you can do them, but at the same time, do in moderation. For me, as a medical profession, I would like to talk about the things that have been tested and proven, because we use evidence-based medicine.
Okay. So there's a question here that has been posted by somebody by the name Reda. She's asking, can you please share if you know about anyone having responded positively to natural medicine opposed to Western medicine? Let me repeat the question again.
Please.
He's asking, can you please share if you know about anyone who has responded positively to natural medicine opposed to Western medicine?
To Western medicine.
Yes.
Brother, that's a good question, and it is a valid question. Because I know as we were growing up, those days we were not exposed to a lot of Western medicine, and people used to get sick, and then they will get some remedies, and then they will get better.
Yeah.
As a medical professional, I'm gonna tell you that there are so many things that we do, and that it does major effect. We just look through everything and support the organs that are failing, and then we let the body take it course.
Mm-hmm.
So asking whether there is any way that I know of anyone, I would say no, because we have never had any tests that tested or that compared between the traditional remedies and the the Western, this so Western medication?
Mm-hmm.
It's a good question. However, we don't have a clear-cut answer.
Mm-hmm. So we'd even encourage our participants, if maybe they have had some, positive response to this kind of natural natural medicine. If they had such, maybe they have ever used them to contribute to us and tell us. Thank you. So we have this question that I would like to ask you, Daktari.
Before we leave that question, I would like to make a statement.
Yes.
It's not once, it's not twice that I have seen a patient come to us who has been at home taking this herbal medication or this therapy that are not proven. Unfortunately, they psychologically give them a boost that they are doing something, but in actual sense, most likely they are not doing anything. And by the time the patient get to see us, they are far gone and we are not unable to help them. So I would say if you have symptoms and you have tried something 1 day, 2 days, it's not working, please go ahead and seek help.
Okay. That's good, Daktari. And let me ask you a good question about, we are hearing about the testing centers in St. Louis. We have COVID-19 testing centers. Can you tell us some of the testing centers that we have around that somebody can run to if you want to get tested for the COVID-19?
That's a good question, but I would say this. Is Dr. Nihao online?
Dr. Niho has not yet joined.
Okay, that would have been a very good question for him.
Yes, yeah, in fact,
because he is with the county department and yes. He is participating in organizing for such. Yeah. However, let me answer it to the best of my knowledge.
Yes.
You have heard CDC saying that we're gonna have testing centers everywhere. It has not rolled out. Okay. We have Massey has one center that's located in Chesterfield, but at the same time, you just don't show up. You have to get an order from your physician who has screened you and thought that you will benefit from being tested before you can go there. And even when you go there, you're gonna need some. You're gonna need more screening to see whether you really qualify or not. Right now, Quest as well as Labco, they are also testing, but still before you do that, you will need to have an order from a physician. Okay. When you come to the hospital, like even in our hospital, we have mounted a tent outside the hospital where everyone who comes with the respiratory symptoms, first of all, goes there to, one, get screened, number two, get tested, and then they are put on a mask and everything, and they are wheeled to a negative room that is in the emergency room, such that by the time that everybody is going there, they know that it's a patient with suspicious symptoms, and therefore you need to protect yourself. Yes. But as I said, we have not reached that stage like they did in South Korea, whereby you get into your car and line up and get swabbed, whether you have symptoms or you don't. Yeah. Currently, even with the CDC, they are recommending to only test the people with the symptoms. Okay.
Now, when you come to the testing, for example, would you like to encourage people to have thermometers at home such that you can be able to test your temperature at home? Is it possible for someone to buy a thermometer from home or to have a thermometer at home? Is it safe to have it? Or what do you advise us to do?
Yeah. So thermometer is a good thing for everybody to have at home, and especially during this period. Yeah. Hopefully you can find it now because I'm pretty sure the shelves are empty. Yeah. However, if you want one, you can check from Walgreens, you can check from Walmart, and they will have a thermometer. And most of them, they tend to last for a long period of time. Yeah. There are those that you put in under the armpit, You can also put under the tongue.
Mm-hmm.
And if you want to go more, become more sophisticated, you can use the one that usually scan the forehead or the ear. Those are called the thermal temperature check. So it's good to have it, but I would like to draw a curve to this one. Not everybody who has this condition will end up with a fever.
Mm-hmm.
So the symptoms of running nose, cough, sore throat, and shortness of breath and joint pains. Now, in addition to the fever, that increases your chances that you most likely has a viral infection. And the question is it the flu? Is it the usual common cold, or is it the COVID-19? But I would like people to know that it's not only fever alone. There
Yes.
are people who are presenting without a fever.
Yes. So can you please repeat for us the symptoms? Those symptoms are very much important. Can you please repeat for us those symptoms that you have said? Because most of us think only that it is only the temperature that you need to check for. Please repeat for us the symptoms that we can really use to identify virus, so that at least it can be a good alarm for you to know I need some testing.
Excellent. I will go ahead and do that. And as I said, in majority of the people, the main presenting symptoms is fever and generalized muscle pain. And there is also running nose, there is sore throat. And at the same time, if the disease progresses, that's when you start developing shortness of breath. So as I said, almost everybody will have a fever, and it's gonna be a fever that's greater than 100.4. Most people, when we have this virus, the fever will be 102, 103. But you can have someone else who has just a low grade fever of 100. But if you have a running nose, watery eyes, sore throat, and then you are coughing, then you need to ask yourself, what do I have? And ask your doctor whether you can be tested for this condition.
Mm-hmm.
One thing that I would like to tell you, if you go to your doctor and your doctor tell you that you don't meet the criteria, or you get tested and you are waiting for the test result to come back, and then you start having shortness of breath, that's the time to go to the ER. This condition is very aggressive. This virus is very aggressive. When you start having shortness of breath, it means that it has gone all the way down to your lungs.
Mm-hmm.
And therefore, you need immediately to go to the emergency room so that you can be admitted and be supported. Yeah. Don't say, oh, I'm feeling like I am having some difficult breathing or some chest pain. I'm going to take some Tylenol and go to bed. Mm-hmm. You may go to bed to sleep and sleep and sleep forever.
Yeah. That's very serious. That's very serious. Now, since you are talking to some of us who are immigrants, I'd like to talk about this issue. Sometimes the immigrants have fear, especially when it comes to the documentation. And maybe we have some of us who are fearing. We have some undocumented immigrants who are fearing to go to the testing centers because they fear maybe they may be arrested and that kind of things. How is the government trying to protect, or do we have any measures to protect the undocumented immigrants, to encourage them to go for testing if they find themselves having such kind of symptoms?
That's a good question. I don't know how to handle that one because that goes to the policymakers.
Yes,
it's tricky, but as an immigrant myself, and I know I've gone through this experience before. I would say right now there is relaxation of everything. Yes, you're gonna go there. We're gonna need to know your name. We're gonna need to know your date of birth, and we're gonna need to know where you are living.
Yeah.
And the purpose for that is so that we can send you the results if you go to a testing center.
Yes.
However, don't fear not to go to the emergency room because of that.
Yeah.
Right now, when I'm speaking, we are also seeing patients and documenting their symptoms and treating them online the way I'm talking to you. We are calling
Oh,
it
that's good.
telemedicine.
That's good.
Telemedicine.
Yes.
Yeah, so we have lifted a lot of other regulations that were there to make sure that we take care of our patients and we don't leave anyone behind. So if you know that you have an issue and you are worried because of your documentation that you're gonna get into trouble, I would suspect that most likely that's not gonna happen, because the crisis that we are in now, we don't have time to follow that.
Yes.
But that's from my point of view. I'm not a policy maker and I don't know how they are dealing with it, but I'll ask everybody who is sick, for the sake of yourself, for the sake of your loved one, go and seek medical attention.
Yes, that's so good. So can I take you back a little bit about the online the online treatment? Maybe how can somebody access online services to have someone to advise him about the disease or how to get tested? Or do you have
So
a link
this is
or a website? Do you have a link or a website that somebody can refer to?
unfortunately, this is things that is being done through the major health institutions that we have.
Okay.
Like now, for me, I don't have any clinic right now. All the patient I was supposed to see this week and have been cancelled. But our institution have come up with a system whereby we can use Zoom or use other means of video communication, and I can see them from their house and they can tell me their symptoms and I can take care of them.
Oh, okay.
As far as an individual one, I'm sorry to say no. And I'm gonna leave it at that, because I'm an employee of St. Louis University Hospital, and I'm bound by their regulation to follow their code of conduct.
Yes. And thank you so much, Dr. Mwangi. I really appreciate your participation. And I would also continue to encourage our participants to continue asking questions. I see we have only 3 minutes remaining. So we might be winding up in 3 minutes. So if you have a question, please, that you want to ask Dr. Mwangi concerning COVID-19, please, I would like you to go to the chat down there in the Zoom. The Zoom window, there is a screenshot called chat. Just go down there and strike that chat and write your message there, and I'm going to find the message and I'm going to read it, and you are going to be answered your question. So Dr. Mwangi, just wait up.
Yeah, thanks, Dr. Mwangi and Jared. That's very good discussion. I think I have unmuted everybody. If you want to contribute or ask a question, you can actually go ahead and ask. I have unmuted.
Oh, very good.
You can always ask. Yeah, and also you can type a text. I mean, on the chat.
Okay, so you recommend you recommend that now they ask questions through the phone, the video.
They can ask question, or has something they want to put across that maybe was not touched in the discussion. Can always share their contribution.
Okay. Thank you so much for that. Thank you. So as we wait for the question, Dr. Mwangi, I would like to ask you about the recommendations that you have for our community, the immigrants community. What are the recommendations? Let me ask you a good question.
Yes.
Do you have any hope that we are going to develop immunity as a doctor? Do you have any hope that we are going to have an immunity? The body is going to develop an immunity system against this disease, such that by maybe 4 to 5 months, we shall be talking about COVID-19 being a bygone case. If you get the disease now, the body can be able to fight for itself.
So that's a very good question, and I would like to approach it this way. That our body is unique in a way that we have our own soldiers that usually protect us and fight for us day in, day out, even at night when we sleep. And we are in contact with so many things in the environment. And we mentioned about immunity. We develop immunity to all these external impurities that come to our body, and our body knows how to handle them. So COVID-19 is new, and that's why we are worried about it, because we have not been exposed to it before. We have our soldiers who are already ready to fight, but they have never been exposed to this kind of a battle. And therefore, they are sort of being overwhelmed before they can train and win the battle. If you get exposed to it once, your body continue to develop immunity. It continue to develop its own mechanism of fighting this virus, such that if you get exposed again, you will not even notice that you got it. It will probably after 24 hours and you have cleared it from the system. And that's what we are hoping, that as many people get exposed to it, we're gonna all develop immunity, and we're gonna be okay. However, before we get there, for the people who are who have other conditions and the people who have immunosuppression, the virus multiplication rate is very rapid and it tends to overwhelm the body. And those are the people we are worried about now. And that's why we are saying, and I will answer your question about a recommendation to our migrant colleagues, is to protect yourself and protect your loved one. And let us follow the recommendation that have been set, and this include social isolation, hand washing, don't shake hand, don't hug your friends. Let's try to keep the young people away from the elderly, the people who have who are immunocompromised, so that we can wait for these conditions to wave off and flatten, and hopefully within the next 12 or 18 months we'll get a vaccine and everybody gonna get immunized, and then we will be able to fight the infection by ourselves. So there is hope. The body is gonna do whatever it does for those who get it and survive it. And we will develop our own immunity and we will fight it in the future. But for those who are immunocompromised, chances are they will not be able to do it.
We have a person that has, we have a known case that we know of a person who has got the COVID-19, who has been treated and gone home.
Yeah, we have so many now.
That would give us hope, because sometimes we may get scared until we are not able to do anything.
Remember what I told you earlier. I'm gonna get it. You're gonna get it. Your wife is gonna get it. Your kids will get it. And everybody gonna get it. But how you're gonna react to it is what is gonna matter. So we keep having so many positive people. Remember what we said. In US, we have about more than 35,000 people already, and more than 80% of these people do well. So what I'm saying is that we will develop it and we will fight it and we will go home. And I will tell you that people are presenting to the testing center and they are going home. They are not going to the hospital.
Good.
They come to our ER with a symptom. They are tested outside and they are told, no, you don't need to come to the hospital, go home. That's why right now our hospital system or healthcare system seem to be working well, because the one that we have don't need our services. But those one who come to us and those few one that gonna get it and they need hospitalization. The one that we are worried, if we get a huge surge of these people, then we're gonna be overwhelmed. But I'll tell you, a lot of people, they have it. They have some few symptoms. They don't even care. It's just regular cold, and they are done.
Yes. Oh, that's very good. That's a very good encouragement. You know, many people are fearing, and they see as if this is the end of life. And if you listen to people in the social media, and you've been watching some videos which have been shot and posted in social medias, most of them are prophesying doom. We have so many people who are prophesying doom.
I know.
That if somebody is suspecting that he is sick, he may not even get a chance of getting to the hospital because of the fear,
Right.
So
and that's what I was saying. That's what I was saying. We have been given all these guidelines so that we can protect those few who are vulnerable. Okay,
yes.
Me and you will get it. We'll fight it. We'll be fine.
Yes.
But if I go to my shosho who has all these issues, I'm writing her or him a death sentence.
Yeah.
So I would like to let people think that there is really nothing happened, and there is nothing really happened because nothing happened to your loved one. But if you pass it to someone else and something happened,
yes,
don't say there is nothing that happened.
Yes.
So the social who I'm gonna go say hi to because I really love them, and then pass it to them, and then something happened. Just because nothing happened to me doesn't mean that nothing happened.
Yeah. So,
and I think we are telling people that we are all heroes by sitting at home and being bored at home watching all these shows and Netflix and everything.
Yeah.
You are being a hero by doing that, and
Yes.
you need to keep doing it until this wave passes.
Yeah, that's good. Thank you so much. So, should we be treating each and everyone as a suspect?
Yes.
No, I think so. That's a very good way of looking at it.
Yeah.
Yeah, don't go shaking anyone's hand, and
Yes.
everybody is a suspect until proven otherwise. So, and actually, that question came during our meeting today because we are concerned. We are being told, no, don't wear a mask when you are at work unless you are entering a patient who is being investigated or who has been confirmed.
Yeah.
Then you are like, everybody is having this thing and moving around. How do I know? I need to protect myself.
Yeah.
But we know we don't have resources to do that. So we are being told, wait until we get to that person who is known to have it. But as you said, everybody should be treated as a suspect.
That's so good. I wish we had with us because he could be answering some.
I wanted to add something.
But I believe with the next.
Yes, sure. Okay.
Otherwise, I see that our time is much gone. It's now for. Yes.
Jared, I just wanted to add something that you guys have touched a little bit. There are some numbers that are there that I think it's good for people to know.
Yes.
That St. Louis City has COVID-19 information where you can call. In the city of St. Louis, you can call 314-657-1499. If you're in the St. Louis County, their number for COVID-19 information is 314-615-2660. And if you're in St. Charles County, that would be 636-949-7400. Missouri Department of Health and Senior Services, they have a 24 hotline number you can call, 877-435-8411. And I think also St. Louis County, they have a COVID-19 alert, which is a text message that comes to your phone. All you need to do is to send a message to number 67283, and the message you're gonna type there is St. Louis Call Alert, one word, STL So STL for St. Louis, ALERT, and then that is a message you send it to the number 67283. So that would subscribe you, and you'll be able to get updates from the St. Louis County of what's happening. This is a message that is coming out from Jefferson City and St. Louis City. If it's anything that is in emergency or anything that you need to know, at least you'll be notified on first hand. The other thing, like Dr. Mwangi has said,
let me ask you, Jeffrey, if you get some time, could you just compile those numbers and distribute them to everyone? Because this is what we are telling people. Don't just get into the car and drive yourself to the ER. You need to make a call first. We need to know you are coming. We need to be prepared when you are coming, so that we can protect other people and ourselves.
Yeah, that's a good idea. Yeah, we have that number. We'll put it together and then we can distribute it to people. And I think to emphasize that, yes, you don't just show up. You have to at least make a call when you see some of those signs. Then you can let them know that you're coming, because you cannot just show up saying that I just want to go for it. But I think the other thing I would say is that we need to read more of what's coming up, especially from the city, not from any other sources that may be confusing, like Dr. Mwangi said. Know the information the source of information that you're reading, so that you can make sure that you're getting the right information.
Yes.
And also take care of yourself. I mean, when it comes to self-protection, I think there's nobody else who can protect you better than you can take yourself, in terms of washing hands, the places you visit, minimizing some of the places we visit, especially as Africans community where we like congregating people's homes. I think this is not the right time to entertain those big crowd in your homes. Like Dr. Mwangi said, you never know who is carrying it. Everybody's a suspect right now. Yeah.
That's good, Mr. Geoffrey. That's good. That's good. Dr. Mwangi, thank you so much for that clarification, Mr. Geoffrey. And I would also like to thank Dr. Mwangi. And for the sake of the information, I would like Mr. Geoffrey to compile those numbers and put them in the social media and then distribute them to the people so that we can help them and sensitize them in the right way on how to handle these situations. It is very much scary when you go to the hospital, when you feel that you have the symptoms and you have not called the doctors and cause a mayhem or a situation whereby, you cause a situation whereby everybody is running away from you. But we have a lot of stigma in some places. Like now, I saw a situation in the social media where somebody flew to Kenya, and then the villagers. By the way, she was tested and she was okay, but all the villagers were calling him or were calling her coronavirus, and he had even to post a video and share it to some social groups and tell them, I am free, I have been tested and I am okay. But you know, we have some people who are not, they are not elite. They have no information, but they just work on stigma. It's good to know how to handle these kind of situations in the society.
Yeah, that's the thing that people need to understand. As we socially isolate ourselves and as we ask for people to quarantine themselves, we should not like stigmatize them. They are still our loved one. It's a virus like any other virus, and it's gonna come and it's gonna stay here with us. The only thing is that we don't want it to catch those who are not ready to get it or who are not in a position to fight it.
Yes. Somebody is asking a question here. I have no name for this person, but it is he's sending the message from Samsung Galaxy S7. He's asking someone, some are needing the doctor's note to be tested. Is that true?
You don't need a doctor's note, but you will need a clearance from the doctor, especially if you have to go to LabCorp or you have to go to somewhere else.
Mm-hmm.
So those places will tell you that, like if you go to LabCorp, they'll tell you, we don't swab here. You have to go to somewhere else to swab you. And then when you go to those testing places, they will screen you. And before they can do that particular test. There are some places that will ask you for an order from your doctor to have it done. And we think that this is temporary. We have been hearing it from the government for like a week now, whereby they are looking forward to rolling it out to have everybody tested.
Mm-hmm.
But now, because we don't have enough test kit, they are trying to preserve them for those who are in the healthcare and those who have the symptoms.
Yes.
Yeah.
That's very good. Now, for the sake of those people who are at home, we have a situation whereby we don't have enough sensitizers in the stores.
Yeah.
So, and do we have any alternative, or do we have any alternative thing that can be used? Maybe you have something like G or do you have that somebody can
No,
use?
wash your hands, wash your hands, wash your hands.
Yes.
Yes.
That's the one. That's will always work.
Wash your hands, wash your hands,
wash your hands. Yes,
yeah.
That will. And the other thing is that soon and very soon you will see them rolling out to the market, because most of other industries have started making them.
Mm-hmm.
And I'm suspecting by mid next month you will going to Walgreens, and as long as you have your own container, they will have some dispensing areas for you to get some. So,
okay.
But that's not coming. That's not here yet. We just have to wait. But I hear all those people, all those industries that make alcohol and all the other places now, they have shifted. They are making hand sanitizers.
Oh, that's good. So we should add the companies that are making the hand sanitizers to hurry up and make sure that they are readily available in the market.
Yeah.
Yeah, and for those people who don't get them, washing hands.
Yep.
Yeah.
That should be the only thing. So,
all right.
Not unless we have any question from our participants, I wish to end our meeting today. And I want to thank you, Dr. Mwangi, so much for your participation, and all the people who joined our meeting today. I believe that we are going to have such meetings, and they are very much important because we have learned a lot. I believe getting information from the horse mouth is the most important thing, instead of getting information from the wrong people. So next time, I hope when we call you, you're just going to join and really come and help us. We need your help.
Thank you so much. Thank you so much. It's an honor for me to be able to answer these questions. You know, we are here for everyone. This is what we have been called to do, and being able to share with what I know is the joy of everyone who is in the medical field. Yes. And thank you, Vitedo for Africa, for organizing this. If you want to have another forum, maybe next week or sometimes like that, let us know. Let us know. We'll be happy to participate as long as we have a common time. Thank you again.
Thank you so much, and thank you everyone for joining the meeting.
Thank you, Dr. Mwangi. Thank you, Gerard. I think that was awesome. Is one of the things that I say is very helpful. We cannot say that we cannot be able to meet because we don't have a lot of, the social distances, and we need to observe that. I think I want to thank a lot of people that I see on the forum. I see Dr. Siganga, I see Dr. Mudoni, I see Rihanna. I see great people that are in the forum, and I'm sure the information that you've been able to share will be helpful, even not just to our family, but also to the people that we interact every day. So, Dr. Walter, you want to say
Yeah.
hi? Say hi.
Hi.
Go ahead.
Oh, hello.
Hi.
Yeah. How are you?
I'm fine. Thank you. Thanks for the information.
No problem. Thanks, man.
Yeah.
Next time they should include you guys. I got all
Yeah,
I
I
need
think
today.
we
I need to share
we'll
some.
need to do organize for next.
Yeah. All right. So thank you.
All right. Thank you so much.
Thank you so much and have a very good evening, everyone. God bless you and stay safe.
Yeah. Thank you. Yeah, stay safe.
Thank you, Rihanna. Thank
All
you,
right,
Dr. Madoni. And I think we will do another meeting maybe in a week's time and see when we have time we can communicate the best time. This was the first time. I'm sure there were some few hiccups here and there. We definitely we're going to improve on that. Some of the areas that maybe we made some errors, but I'm sure the next one will make it better.
All right. Thank you so much, sir.
Thank you.
All right. Take care.
Right.
Stay
Thank
safe
you.
and make sure everybody is able to participate for the census. We know this is the best time to complete your census.
Good.
Thank you. Thank you, Geoffrey. Thank you, sir. Thank you so much.
Thank you. Bye. Thank you.
Bye-bye.
Bye.